So, does vasectomy have the potential to ruin your sex life? What is the point of having surgery for contraception if you can't perform afterwards? Well, in the next few minutes, I'm going to tell you the truth about vasectomy and its effects on your sex life. My name is Dr. Simon Snook. I'm a sexual and reproductive health specialist, and this is the Kiwi Sex Doctor, where I give you tips, tricks, and hacks for a better sex life. So there are three main areas of sexual functioning. That is your libido, or how turned on you are, your ability to get an erection, and of course your ability and the quality of your orgasm. Now what we're going to look at in this short video is how vasectomy may or may not affect each of those areas, so that you know whether or not you should get the surgery done. So let's start with sex drive. Well, sex drive is mainly happening well above the level of the trousers, okay? All of our sex drive comes here from our brain. Very complex interactions between neurochemicals, obviously the psychology plays a big part, and in terms of hormones, the hormone testosterone has a very big influence on our sex drive. And many people are aware that testosterone is produced by the testicles, and therefore when you think about having an operation in the scrotal region, you would think potentially about the effect that this may have on your testosterone levels. Now, the good news is it has no effect whatsoever. Why? Well, let's look at it a little bit more closely. A vasectomy cuts the vas deferens, clips it, burns it, severs it, ties it back, something to stop the sperm getting from the testicles to the outside world. Now, the testicles, as I said, also produce testosterone. However, that gets to the outside world via the bloodstream and the blood supply to the testicles. Also, the message from the brain telling the testicles to produce testosterone also gets there via the bloodstream. So the little tube that's been cut to stop the sperm doesn't have any effect on that feedback mechanism and the blood system around there. So many studies have shown that after a vasectomy, a man's testosterone has not changed from how it was prior to his vasectomy. So biologically, there are no reasons at all why a vasectomy should affect your sex drive. In fact, there was a 2015 study in the Journal of Sexual Medicine which actually showed that men who've had a vasectomy seem to have sex more often than men who have not. The average goes up from about 5 times a month to 6 times a month. So an extra time a month, that's an extra 12 times a year. Probably worth having a vasectomy just for that. So what about erection? Probably the most talked about area of sexual dysfunction in men. So could a vasectomy affect your erectile function? Well, in short, no, it can't. So why is that? Well, an erection will occur in response to a sexual stimulus. Messages from the brain go down the spinal cord into the penis, telling the blood vessels to dilate and the penis to get hard. So if we look at a vasectomy, the surgery is occurring in the scrotum. Now, the good news is that the nerves going from the brain down to the penis don't actually go anywhere near the scrotum, therefore they could not be damaged in that procedure. In addition, the blood vessels that take the blood into the penis equally don't go through the scrotal area. So categorically, a vasectomy cannot cause problems with your erection. In fact, in another study in 2017 in the European Journal of Urology, they actually found an increased level of satisfaction sexually for men following a vasectomy. So what about ejaculation, the final area of sexual dysfunction we're looking at here? So to start with, let's look at the ejaculate itself. Now, 98% of what is ejaculated from a man comes from the prostate glands and other glands around that area. Now, those are glands that are up inside the pelvis. Only 2% of what comes out in the ejaculate is actually the sperm, the bits that can get people pregnant, and they're the bits that are therefore cut off from the supply, and that is why a vasectomy works really well at stopping anyone getting pregnant. But if you remove 2%, the actual consistency of the ejaculate, the amount of the ejaculate really remains unchanged. In fact, there's a scientific study, not a particularly good one, showing that even the taste doesn't change. If you want to change the taste, eat pineapple and stay well away from asparagus. So what about the climax, the pleasurable experience of having an ejaculation? Well, the feeling of that comes from rapid contraction of the pelvic muscles, which then send messages back through the nerves, through the spine to say this is feeling really nice. Now, the pelvic floor muscles are way up above the level of the scrotum again, and it's not actually any sensation from the scrotum, although sometimes it can be felt there, that gives that pleasant feeling of climax. It's from further upstream and in the pelvis itself. So yet again, neither the nerves or the muscles are anywhere near where the vasectomy surgery happens, so the experience of climax should be completely unchanged. But, and here's the big disclaimer, psychological well-being is so important for sexual functioning, and for some people having a vasectomy can affect their psychological well-being. And if your psychological well-being is affected, you could have sexual dysfunction problems throughout all of those areas: libido, erection, and ejaculation. Now, there are studies that show the majority of people have improved sexual functioning after vasectomy. That doesn't mean as an individual you may not. And one of the biggest and most important factors here is how willingly you have that vasectomy. Now, there are a group of people who are somewhat forced into the vasectomy by their partner for whatever reasons, or they go into a vasectomy feeling, if I have a vasectomy, my sex life will pick up. And it won't. If your sex life isn't any good right now, having a vasectomy isn't suddenly going to make it any better. And if you are in that group, you are a much higher risk of having a vasectomy and having psychological damage from it. So the most important thing that I'm going to say in all this video here is vasectomy is fine for sexual functioning if you want to have one and if you are sure you want to have one. If you get past that bit, everything else will be absolutely fine. So I hope that video has been helpful to you. If it has, please do give me a like and subscribe. We have other videos on here related to vasectomy and of course many other videos related to sexual functioning. Thank you for your time today and see you again.